Firstly, using the stethoscope on the chest, I just listen for a heart rate and listen to the rhythm of the heartbeat. This is just to ensure that we're not too deep and also there's no arrhythmias occurring. Also using the stethoscope, I listen to the respiratory rate and also just take note of how much effort is used whilst breathing for the patient. This can help determine the depth of anaesthesia, as if we start increasing our breathing and there's effort, that could be a sign that we're too light. So next, using the pulse oximeter, I check the SP4 reading of the patient, which should be on 99. So next, using the Doppler on the hind leg, I check the patient's blood pressure. So this is also to help determine if they're becoming too deep. So if it is below a normal range of 90 systolic, then that could be a sign that they are too deep. If turning isoflurane gas down doesn't help increase the blood pressure, then we may need to resort to putting them on IV fluids. Also checking the pedal reflex, I pinch between the toes on the hind leg and pull just to see if there's any withdrawal. So if the patient does pull back, that can be a sign that they are becoming too light under the anaesthetic. As this is a dental procedure, I do not have access to the mucous membranes, the capillary refill time, the palpebral reflex, or the jaw position, the jaw tone. So I just communicate with my vet at all times and she can let me know. We ideally want our patient's eyes rolled with no palpebral reflex, so no blink, and also we want pink gums with a capillary refill time of under 2 seconds. So this is to help us be aware of oxygen saturation or any hemorrhaging, and also our blood circulation, and this is also to determine if they are becoming too light or too deep. The patient's body temperature is also taken by using a thermometer in the anus against the rectal wall. So this is to help us obviously get their body temperature, to keep an eye on if they become hypothermic. After checking all the vital signs and communicating with the vet, it is determined that we are in a surgical plane of anaesthesia, which is great. So that is to just continue monitoring and confirm that we're still nice and comfortable. But after the vet has communicated to me that we are slowly getting towards the end of our procedure, I can slowly start lightening my patient up to prepare for recovery and extubation. So therefore, using the anaesthetic machine, I turn our isoflurane gas level down slightly, and I will continue to monitor the vital signs.